Hello, I am Dr. Abhinandan Punit, consultant orthopedic surgeon with special interest in robotic hip and knee replacement and sports medicine. Let's talk about hip replacement. Now, what is hip replacement? It is a replacement of a ball and the socket which are damaged due to either arthritis or avascular necrosis. The most commonest cause of problems in hip are arthritis and avascular necrosis. Arthritis usually happens in old age people. Arthritis can also happen after a fracture of the hip joint. Now, avascular necrosis, the word itself is avascular, means there is lack of blood supply to the ball, leading to collapse of the bone. That is called avascular necrosis. This can cause severe pain in the hip joint. Patients usually start with having mild pain in the groin area. As and when the disease progresses, they will start getting more and more pain, and walking also becomes difficult, including sleeping at night or turning in the bed also becomes painful. That is, and when they reach advanced stage. At advanced stage of AVN is called advanced arthritis. So end stage of any hip injury will lead to arthritis. So when you have advanced arthritis, recovery after medication is not that good. The only long-term sustainable solution would be going for a hip replacement. Now, hip replacement is one of the best surgeries of 20th century, where almost 90% of the patients do feel that life has changed after the surgery. So it is one of the revolutionary surgery in orthopedics. Now let's talk about hip replacement. Hip replacement means we replace the ball and the socket so that the damaged parts are replaced with an artificial ball and a socket. Whenever there is a hip movement, there is no friction between the two bones, which can cause pain. Now, hip replacement, what we need to know is what are the types of hip replacement, approach. How do we do a hip replacement, and what are the materials are required for a hip replacement, and what to expect after hip replacement. Now, let's dissect one by one. Now, how do we do a hip replacement? Our approach to the hip joint. A hip joint is a ball and it's a socket joint. It's a deep joint, and it leads to the movement of the hip whenever we walk. Now, to approach a hip, either we can go from the front of the thigh or the side of the thigh or from the back of the thigh. That is called the anterior approach, lateral approach and the posterior approach. Major part of Western world, earlier we were doing a posterior approach, which means we are going from the back. Here we cut some of the major muscles to enter the hip joint. In recent years, let's say in last 10-15 years, across the West, the interest in direct anterior hip replacement has emerged, wherein we approach the hip from the front part of your thigh without cutting any muscle. We don't cut any muscle, we just separate the muscle and then we carry out this procedure, and then it has its own advantage that I'll discuss later. And the third approach is a lateral approach, where we'll enter the hip joint from the side of your thigh. Here also we have to cut some major muscles to enter the hip joint. So these are the three major approaches through which hip replacement can be carried out. Now let's talk about the materials, or what are the type of material available for a hip replacement. Right. So as you can see, this is a model of pelvis with the hip joint. Now let me explain what is a socket, what is a ball, and how do we do a hip replacement. Now let me dissect these things one by one. Now this is your pelvic bone. This pelvic bone has got a circular hole here, that's called a hip joint, where is a socket, and the socket also will be damaged in arthritis. So we put this artificial metal socket which goes and directly sits in this one, and it gets attached to the bone. Either we can attach directly to the impact to the bone, or we can put some screws, and this is called the socket. And then when we come on the thigh side, we have to change the ball. Now the ball, what we do is we cut the bone like this and we insert the artificial stem. The artificial stem is inserted inside, and this is a ball. So we put a stem inside the thigh bone, and this is the ball, and when we put them together, this will form a hip joint. This is a total hip replacement, wherein replacing the socket and the ball. This is a total hip replacement. Now, hypothetically, let us say I don't replace this socket. If I do only this bit, retaining the original socket, is called half hip replacement or hemi-arthroplasty.